everyone. I'd like to call this meeting to order. Welcome to meeting number 17 of the House of Commons Standing Committee on Procedure and House Affairs. I'd like to start the meeting by providing you with some information following the motion that was adopted in the House on Wednesday, September 23rd, 2020. The committee is now sitting in hybrid format, meaning that members can participate either in person or by video conference. Witnesses must appear by video conference only. All members, regardless of their method of participation, will be counted for the purposes of quorum. The committee's power to sit is, however, limited by the priority use of House resources, which is determined by the whip. All questions must be decided by recorded vote unless the committee disposes of them with the unanimous consent or on division. And finally, the committee may deliberate in camera, provided that it takes into account the potential risks to confidentiality inherent to such deliberations with remote participants. Today's proceedings will be made available via the House of Commons website. A reminder that the webcast will always show the person speaking rather than the entirety of the committee. To ensure an orderly meeting, I'd like to outline a few rules to follow. For those participating virtually, members and witnesses may speak in the official language of their choice. Interpretation services are available for this meeting. You have the choice at the bottom of your screen of either Floor, English, or French. Before speaking, click on the microphone icon to activate your own mic. When you are done speaking, please put your mic on mute to minimize any interference. And a reminder that all comments by members and witnesses should be addressed through the chair. Should the members need to request the floor outside of their designated time for questions, they should activate their mic and state that they have a point of order. If a member wishes to intervene on a point of order that has been raised by another member, they should use the raise hand function. This will signal to the chair your interest to speak and create a speakers list. In order to do so, you should click on the participants icon at the bottom of your screen. When the list pops up, you will see next to your name that you can click raise hand. When speaking, please speak slowly and clearly. Unless there are exceptional circumstances, the use of headsets with a boom mic, one of these types of microphones, is mandatory for everyone participating remotely. Should any technical challenges arise, please advise the chair, and please note that there will or may be the need to suspend for a few minutes to ensure that all participants can participate fully. For those participating in person, proceed as you usually would when the whole committee is meeting in person in the committee room. Should you wish to get my attention, signal me with a hand gesture, or at an appropriate time, call out my name. Should you wish to raise a point of order, wait for an appropriate time and indicate to me clearly that you wish to raise a point of order. With regard to the speaking list, the committee clerk and I will do our best to keep consolidated order of speaking for all members, whether they are participating virtually or physically in person. Okay, with that being said, I'd like to welcome Dr. David Williams to our committee. Thank you, Dr. Williams, for allowing us some time out of what we do know is an extremely, extremely busy schedule and very challenging time for all of us, federally and provincially, and you have been doing some fantastic work. So Mr. David Williams is the Chief Medical Officer of Health for the Ministry of Health in Ontario. And Dr. Williams, you have 5 minutes for your opening remarks, which will be followed by a few rounds of questions by the members. Thank you.
All right. Madam Chair, I'm assuming you can hear me okay?
Yes, we can hear you very well.
Always important to check. Make sure you're not on mute. We get used to this routine very much. So thank you for inviting me today to present. And I thought I'd start off with just giving you a sense of where we are in Ontario at this time. Since we've been at this now since January 2020, it's day 320. Of this, and we had the first case reported in Canada, and we now have a total of 134,783 cases of COVID-19 reported. Over the spring and into the summer, we flattened the curve down to a very low, less than 100 cases a day, even lower than that, and then started rising again in September, much like other provinces and more lately some territories have done. Today, on December the 10th, for example, the numbers keep changing. And we have a record high of 1,983 new cases reported of COVID-19 in a single day. Our testing volumes remain high. So today, again, we did just over 62,000 tests for the day, and we continue to be averaging between around mid 55 to 58,000 tests a day going through at this time, and we're adding more testing with more rapid access testing components in there. We're also doing some of those, another 3 to 4,000, and we're going to be adding more in the near future. Most of our cases tend to be concentrated in our hot zones, so-called in the areas of Toronto, York, and Peel, which make up 60% of our cases. And they are spread out throughout the health units in the province of Ontario. I'll talk about that in a moment. The long-term care and overall mortality continue to increase. So as we see our cases, we have the lag of 3 weeks, and then we start to see hospitalizations, and we start to see deaths rising. And so we continue to note that with now we're exceeding, and we're thinking it'll exceed 25 deaths a day. This is, while less than the first wave, is nevertheless ongoing concern and most unfortunate. The reproduction, or the RE, our effective they talk about, is fluctuating just around 1. And we're hoping to get that down below 1 to see it start diminishing again, to see if we can come down off the peak of the second wave. We're sort of on a high plateau in a precarious state, waiting to see if we're going to go back up or come down again. Our ICU capacity and our hospital capacity continues to be challenged. We have over 200 beds now occupied in intensive care with COVID patients out of our approximately 17 to 1,800 beds. The challenge there, of course, is that unlike the first wave, where we had stopped all elective surgery, we have all our hospitals up and functioning full tilt, and that means these beds are pushing in with other cases, including those with elective surgery that are in there for a day or two post-op and are requiring the need of those beds. So that is putting stress on our system, which is, a lot of it is over 90% occupancy. So we remain in this precarious position as we have a number of aspects there. In order to deal with this, and that's the uniqueness of Ontario, and probably affects the elections process, we have, unlike other provinces, 34 autonomous, municipally incorporated public health units in the province of Ontario. And they range in size, Toronto being the biggest, about 3.4 million, down to small ones of about 38,000 in the north. They cover all the geography in Ontario, including those where there are First Nation communities located. And each of the medical officers there's 34 of them, and their staff have that authority under boards of health to be responsible for the public health in their respective jurisdictions. In order to assist in the overall impact of the COVID, we have moved after our initial phase of closure and opening up. We have moved to putting in we so-called Ontario's response framework, keeping Ontario safe and open, which we initiated in September, October, and it has indicators in each of the levels with color zones and names to them. Green, the lowest, is in a prevent mode, and most of the things are on an ongoing prevention basis, and those remain low numbers, usually less than 1%. Yellow is in the protect level and has its own percent parameters and cases per 100,000, and orange is the restrict level. And then we have red in the control level. That's anything above 40 per 100,000 or percent above 2.5% positivity in the lab test coming in. This means we have 34 different areas in different color zones, and they can move, and we review the data weekly and then recommend if health units in those areas are moving up to these new zones or moving down. We also have gray or lockdown zones, and those are in effect at the moment in Toronto and in Peel. And when there are a number of metrics met that indicates that we have to put them into a lockdown mode, knowing that unlike our first wave, they're not in total same. We still have our long-term care allowing essential visitors. We still have our schools open, even at this date, up until Christmas. And so we have a large student body with 2.5 million students. And we have most of our 1,400 schools are open. We only have at the moment 10 closures in the province of Ontario. And some of those are not due to outbreaks, but they're due to administrative reasons where they, with staffing situation, they have had to close as well. So not all due to outbreaks, and there are child care centers as well. And there's another difference between wave one is that we haven't stopped elective surgery. We're trying to catch up on that to make sure that people are not having increased morbidity or mortality due to delay in essential investigative and operative procedures. So that's how we're structured, and that's how we're dealing with right now. And we're doing some modeling and projecting to see how will we fare as we go through. And then, of course, as you've all heard the news, as we start into the early stages of vaccination and the process that that's going to carry and go forward, hoping to keep ramping that up into the new year. So now for the opportunities or issues related to conducting elections in Ontario. My office has been involved with the discussions with Elections Ontario as well, advising, and there's an opportunity to learn from experience. It'll be important to document and share these at the federal, provincial, territorial levels. So Ontario supports the committee's acknowledgement that the administration of an election should be executed without creating further barriers to voting, especially in consideration of providing every individual who is legally able to vote with the opportunity to vote, regardless of accessibility needs. That means using assistive voting technology and other types of assistance at the voting location, zones within Ontario, COVID-19 status, and place of residence, such as correctional facilities, long-term care, group homes, etc., and other congregate settings. There is a need to ensure that the election administration plans include contingencies and can be readily adapted to be sufficiently nimble in processes to respond to the changing situation in each jurisdiction. Because this is an ongoing COVID outbreak, it is changing by the day and the week. And with vaccination coming in, it'll have further impacts that we're going to have to take into consideration as we continue on this journey. And so we have to be nimble and deal with the issues as they arise and be responsive. Some of the overarching challenges include harnessing up front the opportunities for minimizing travel and gatherings, especially in consideration of one, using mail-in or virtual voting, actual day of voting, weekend or work weeks, variations in public health measures that are in place in our communities, such as access to large community centers, settings and lockdown are limited, and how we might have to modify those to allow people to come into the building at a certain time, proper space in the lines, and as well as proper precautions in each of the locations for the administration staff, volunteers, scrutineers, as well as candidates. We need establishing linkages and regional local authorities to support the election process, such as how we link in with our health, education sectors primarily. We want to establish consistent and tailored processes for voting locations. Are they in schools? Because remember, our schools are in certain status and situation. We don't allow people into the schools at the moment because of our policies and directions there. Community centers are mostly closed, but they could be open, but they have to be established in that line. And the specific processes for long-term care and other types of congregate and facilities. Other considerations might be processes in place to screen those who are entering a polling station and separating electors from who are unmasked or screened positive. And how do we do that? Because if you're positive and you're in your quarantine period, can you vote or not vote? How would you handle that type of process? Establishing capacity limits and traffic flow. Of course, there's the ongoing cleaning and disinfecting protocols for all surfaces and equipment. So we would like to recommend also that a comprehensive training program would include dry runs through the various scenarios, establishing worker screening processes that will take into account the locations of their work the day of the elections, including any movement between locations and mobile voting processes. So we don't want people moving from our high lockdown zones into red zones into different ones. We'd like them to be in that type of setting and to stay in those locations. So they're planning ahead where their movements might be and to minimize that. So if there was outbreaks, they would not be attributed to the workers involved in doing that kind of process. Ensuring consistent worker protection, of course, across all the voting locations, whether in the different settings we've talked about already, and where there are varying types of levels of interactions with electors. So overall, these are the general parameters. I think, as I've noted in Ontario, it's a big province, wide areas. We have many number of remote First Nation communities and challenges with accessing. And we have a large geography as well as the largest population to work through. So we have to work that in our various settings and locations. So we hope that we can be able to assist and work if and when that was necessary, and in response to the changing COVID situation as we continue to experience. So thank you, Madam Chair.
Thank you, Dr. Williams. Some great proactive recommendations there for our committee. I know there's so many questions we would probably like to ask Dr. Williams, being from the largest province, but we're going to keep our focus on the study that is at hand, and that is of the federal election during a COVID-19 pandemic. So we'll start with the first questioner for 6 minutes, please, and that's Ms. Vecchio.
Thank you very much, Chair. And to begin, I would really like to thank you, Dr. Williams. As a resident of Ontario, I imagine the last 320 days, you have probably had no sleep. And I would really like to commend you to the work. I know that I am fortunate to have both Dr. Mackey and Dr. Locke in the southwestern Ontario and London Middlesex area. So I recognize what an effort that you are putting forward, and I do greatly appreciate it. Just a few questions for you specifically. We've obviously had 2 by-elections in Ontario, specifically under the federal government. There was one in York and then one in Toronto specific. Has there been anything that's come out of those centres that could be elected or that could be linked to the election? Are there any concerns of holding those by-elections back in November?
Thank you. And through the chair, we had asked for our local health unit to document that. We have not seen any impacts related to that. So we were pleasantly surprised that it went very smoothly, and we could not identify any exacerbation of cases related to those events, and had been attributed to the locations of the various scrutineers, et cetera. So it was a well-run process.
That's fantastic to hear. Thank you for that good news. What were some of the restrictions? I assume that Elections Canada was speaking to you very frequently, or speaking to the people in the Toronto area frequently on this. But what are some of the suggestions that were made to ensure that the voters, the candidates and their teams, as well, of course, of all of the staff that are going to be there, how did we ensure that they were safe? What were some of the guidelines that you provided?
So a lot of the guidelines, of course, are stipulated by the local medical officer of health, namely a lot with Toronto Public Health, through Dr. Eileen Davila and their team, to make sure that they were following the standards and protocols that were in fact during their time, which I think they're in the, we called modified level 2, stage 2, before they moved into the red zone and now subsequently into the lockdown zone. So even now their standards have shifted a bit, but they were asked to do the proper minimalizing of gatherings, indoor and outdoor, as well as proper distancing and masking, and limiting the access points, as well as ongoing, as I've noted in my comments already, cleaning of surfaces and keeping people moving through, so there wasn't congregation of larger numbers in any setting. So they would have taken those from their medical officer that was specific to the zone that they found themselves in.
Excellent. When we were going through that, were there any rapid tests or anything like that Elections Canada had worked with you to make sure that people were safe? Or was there anything available at the time? And if so, would you be able to have used those?
We didn't use any rapid testing at that time. We still had lots of capacity in our daily testing through our assessment centers, which are in each of those locations. And mostly because we were putting our confidence in the PCR test. We've been doing a lot of working through of the various models of rapid testing. We're trying to use those in areas where we can't, say, to geography, move the test through quick enough to get people so there's turnaround time is adequate. Those locations are very central, so we didn't have to worry about that. As well as we want to make sure that we had the proper quality checks in those testing methods. If you're in high zones of positivity, to use some of those tests that have less sensitivity, if you may, then you have a certain rate of false negatives, which would be not what we desire. So you have to put in testing protocols that would overcome those. So you want to use them in the right areas with the right group at the right time, administered by the proper experts, because some are changing from the nasopharyngeal swab to intranasal, buccal, and oral. And then we're testing also some saliva mouthwash type methods as well. So there's a lot of new technology coming in, but we didn't use them for those by-elections.
Excellent. Thank you. You mentioned when you were talking about long-term care homes, I think that's one thing that all of the members on this committee are very concerned about, looking at the long-term care homes, looking at those who are most vulnerable and disabled to make sure that they are safe. And you indicated that we should screen those coming to the long-term care homes. What would that screening look like? Would it be those types of tests that you were just referring, like the I don't know if it's sublingual, subbuccal, those different things? I take it that's just the swab of the inside of your cheek, perhaps. I'm not sure exactly. But would those be easy to administer? And do you feel that we must ensure that all Elections Canada, let's start with the long-term care homes, but ensuring that everybody is tested or has those types of screening done? And then how can we do that at the larger picture as well?
So our testing in our long-term care facilities is of major concern to us. We're continuing to increase the security around the long-term care facilities where we have high levels of transmission in some communities. There's more and more cases coming in, usually through the staff, volunteers, and essential visitors. So we're putting in strident measures to make sure that everyone, first of all, with the security guard in some of the lockdown zones, that the person is asked about history of signs and symptoms. They have to show proof of having had a test done, not just attestation anymore. We're going to go over to show that you've had a test in the last week. So we're going to weekly testing. We're talking about whether we would have to go up to even twice a week tests with some of the rapid tests in there. We have not yet implemented that, but regardless of the steps we put in, there still seems to be infections coming into these locations. And once it gets in there, it spreads quite quickly. So we have to put as many barriers around them as we can. So I think if you're asking people coming in from the outside, if you're not a staff member and you're not an essential visitor that has registered and has been noted in the log, and you haven't got your proof of testing, you will not be allowed to enter the facility. Whereas in some zones out in the green, it's less stringent, and the yellow. So there's a variation across the province, but we're trying to put these measures in, and if we're going to implement a rapid test methodology, we're going to have to make sure that it's done with the proper sequential timing to ensure that we rule out any misgivings of the test as in false negatives. So
Thank you.
Right now you have to get those other tests done.
Thank you so much, Dr. Williams. I appreciate your time.
Thank you to both of you. Next up, we've got Dr. Duncan, please, for 6 minutes.
Thank you, Madam Chair, and we thank Dr. Williams for being here. We appreciate your time and effort, especially during the pandemic. My focus is protecting the health and safety of Canadians should there be an election, and particularly protecting the most vulnerable. I have limited time, and so I will be largely asking for yes or no answers or one-word answers. In Ontario, does the impact of the pandemic vary across public health units? Yes or no, please?
Yes.
Thank you. In Ontario, does the impact of the pandemic vary within public health units? Yes or no?
Yes.
Could you tell me how many long-term care homes in Toronto are in outbreak today, please?
I'd have to look at my sheets. I can't do a yes or no to that.
Well, roughly.
I just look at my data for today. If you give me a moment, a second. I didn't know you were going to go that detail.
Maybe I can come back to that.
Please do.
Because time's limited.
Right now we have 7 long-term care homes in outbreak in Toronto.
And all of Ontario, please?
All of Ontario, we have, I got to get the total up here, 21 long-term care. And when we say outbreak, there can be just one staff member positive, so it's not in full-blown outbreak. We have a very open definition for early warning.
I understand that. And that's for all of Ontario?
Correct, of our many homes.
How many long-term care residents have we lost in Ontario during the second wave?
The second wave thus far were, now you guys another data metric. Let me get that one over here. So I'll go ahead and ask another question. I'll look that up for you.
And I will also be looking at the cumulative number since the pandemic began for long-term care, please.
Cumulative number. Well, we were at, in the first wave, 1,800. So I'll have to look that one up for you as well. So I'm just trying to get the totals. We had another 17 deaths in long-term care yesterday. And so we're getting close to around 500 again for the second wave as compared to the first wave, which was 1,800. And what was the other question you asked?
So we're at 2,300. Thank you. Yeah, we're all terribly saddened by this.
Yes.
What is the test positivity rate for Peel, please?
The test positivity for Peel at the moment, get my other sheet out, is 9.8%.
Thank you. And for York?
York Region is 6.1%.
Thank you. And for Toronto?
6.1%.
Do some neighborhoods, for example, in Toronto, have higher test positivity rate than the 6.1% you just gave?
Yes.
Are different types of housing associated with different types of case growth?
We're finding that it was more varied where you have high neighborhood ethnic variation and you have multi-generational families in one residence. So that seems to be more of a factor than social economic status per se. It does play a part. So we see a higher risk in lower SES, as well as much bigger difference almost from the quintiles of racial diversity. The lowest being around 15 per 100,000, the highest at the moment 170 per 100,000.
Can you explain the 170 per 100,000, please?
That means when we take our data and break it down to areas that have certain definitions from the statisticians who do it, that have quintiles of neighborhood racial diversity in areas under postal codes, goes from the lowest to the highest. And so the highest quintile has a rate at the moment has increased up to 170 per 100,000 from the data we have from testing that, knowing that the testing penetration varies from area to area depending on cultural issues, access to testing facilities, et cetera, et cetera.
Thank you very much. Is asymptomatic testing happening in schools, yes or no?
Yes.
In how many school boards is asymptomatic testing taking place, please?
We're mostly doing it in the different health units or choosing different schools to go in and test. And so we're undergoing that process at the moment, doing some in different areas like Ottawa, Toronto, Peel, mostly in the hot zones, if you may, and going in where there are no current outbreaks, but cases are coming to the school and they're in neighborhoods of high transmission.
Right now, this work that's being done, how many schools is asymptomatic testing taking place in, please?
I'd have to look at our list because we have a table that deals with that. There have been about 12 or 8 to 10 so far. They've got another in the offing, another 8, 12, or 13 coming up before the Christmas break. So there's different ones moving through with elementary and secondary.
Perhaps you could table that with the committee, please. And so during an election, if we look, for example, at Toronto with different neighborhoods having different test positivity rates, does mobility play a role? Can mobility affect contacts?
I'm trying to think where you're going with that question. So the students don't move around. They go to the same school.
No, I'm not going on schools. I'm just asking, can mobility affect the potential for contacts, please?
Oh, definitely.
Thank you. Those are all my questions, and I thank you for being so gracious.
Thank you.
Thank you. Monsieur Terrien, 6 minutes, please.
Hello. Thank you very much, and I'd like to welcome the witness and thank him for coming today. Now, I'm just going to make a comment for 30 seconds. Today, the government tabled a bill amending the Elections Act. We had been working on this for a while. We were not warned at all. We weren't given any notice. This was done at the same time we were conducting our own work, and I think that shows complete lack of respect for people who are working on this committee and the witnesses who were paraded before us and wanted to share their knowledge and their expertise with us. So I think it's very unfortunate what happened. It doesn't seem like the work of parliamentarians is respected. I'm very disappointed in this government and its behavior. Now, I have a few questions for rapid testing, about rapid testing rather. You said that you didn't use rapid testing during the by-elections. Did I understand you correctly?
That's correct. We didn't utilize them in those locations because we had access to the assessment centers and our PCR testing.
Thank you. And is it because they're less reliable?
The PCR test is very sensitive and very specific, so we have full confidence in it. Some of the rapid tests have some variations and lesser qualities in there, and therefore we have to put in some processes to do that.
Okay.
Thank you. And just for information's sake, in Quebec it's different. When you do a test in Ontario, currently, if you're doing the nasal test, how long does it take before the individual receives their results?
This is a continual challenge, especially when you're putting through 55 to 60,000 people from our 149 testing sites in there. And we were trying to get our turnaround time. Definitely, we have 80% that are within 48 hours of the test or under that, and we're getting close to 90%. So we want our turnaround time to be ideally within that time, but some northern areas have a longer time due to transportation issues from the time the sample's taken until it gets to the testing site. So some are longer, and we're hoping to use rapid tests and more point of care testing to see if we can overcome that timeline.
Thank you for that. So rapid testing is less reliable, so you prefer to wait a little but have a more reliable result, from what I understand. Now, will you be consulting other provinces? For example, if there's a general election, will you consult with other provinces to find out what steps you might want to take yourselves? Obviously, you're responsible for your territory. However, sometimes other suggestions from other provinces can be useful. Do you plan on doing that, or have you already done so?
Since the onset, we are on the Special Advisory Committee with the Public Health Network Council, which is chaired by one of our Chief Medical Officers of Health and by Dr. Teresa Tam. And we meet sometimes twice a week, 3 times a week on various topics, including we share on issues of concern and matters. We haven't specifically talked about this one, but we would be discussing it if and when it did occur.
Are you speaking about elections now?
We haven't had any specific discussions on that at this time because we didn't know any that were coming in the near future. We discussed the topics of most pertinence. Right now, it's all tied up with vaccination.
Why?
I see. Yes, I would imagine that would be your main concern. Now, there are various areas that are hotter, as you said, than others. You mentioned Peel in Toronto. Will you be using the same way of proceeding throughout the region and the province, or are there places where you're going to be much more focused and much more cautious? So are you just going to have a blanket method in, say, voting stations or when it comes to voting, or are there areas where you may be able to be more flexible, for example?
Quality of the framework, I apologize for that. Part of the quality of the framework is that it allows some variation of limitations of settings and congregate depending on the percent positivity in the area, the number of cases per 100,000. So you can be more free or more open to that. So that will vary. And then the local medical officer of health, who has responsibility in that area, can put in other orders and limitations if there is areas of acute concern in certain settings. So we have our provincial framework, and then that allows a baseline, and then the medical officers can add more on if they so wish.
Okay.
Thank you. So it is possible then to adapt. Thank you. My last question is this. Is the pandemic so bad right now to have to cancel any elections? Just to say, for example, it's not the right time. Maybe we can do this later, but now is not the time. Do you think the situation right now is serious enough to say something like that?
On a pan-Canadian basis, or some provinces, I'll have to leave that for their counterparts to comment. Right now in Ontario, where we're, our latest data was 82.4 per 100,000. Our active cases, which puts us, I think, one of the lowest outside the Maritimes. So we're still okay at this time. The key is that if it's done over time with the use of all the technologies and limited congregate large gatherings and putting all the checks and balances in place and allowing for that to occur, it can still happen at this stage. We haven't yet had to go to total lockdown, as in like curfews and things like Melbourne, Australia. We haven't done that. So I would say we're still okay at this time.
Thank you, Dr. Williams. Next, Mr. Blakey.
Thank you very much. Just following on that theme, when you say that it ought to be done over time, we've heard some discussion here at committee about about the length of the writ period, or the length of the election itself. The elections law allows for some variation, between, I think it's 35 days and 51 days. Do you think it would be good if there were an election that the government adopt the longest possible writ period in order to provide additional time for implementing some of the measures that you had mentioned in your testimony?
I think with the use of virtual type components and spreading out the people, you can cover a lot of people in a short period of time. I think we watched what happened down in the US to see what worked and didn't work. And we're trying to really discourage large mass gatherings of groups where distancing can't be maintained. And I think if either you can do that through technology, or if you have to have a number of events over a more prolonged period, the key is to keep those numbers down and keep people spaced, both in time and place, so you can have the prevention in place. So both could be utilizable. I just think we'd have to always monitor them and to document that we were careful, because I don't think we want to have outbreaks attributed to any election processes, and try to protect the public as much as possible.
So to the extent that, each person only votes once, and they either do that in a shorter period of time or a longer period of time, is it easier to spread people out over a longer period of time than a shorter period of time?
I was thinking more the longer period to allow for advanced polling and voting. Mm-hmm. And people can do it electronically or through different processes, so they can exercise their full privileges, especially those that have more accessibility problems, and they could do so. Sometimes if you talk about long-term care, having their essential visitor go and obtain that, and then to go back out and submit that through mail and other processes that are deemed to be. So to allow everyone to have the possibility to vote, and that the certain barriers and protections would not be an impediment to that. Sometimes that may take a bit more time.
As a public health expert, I'm sure you know, and I'm seeking some of your wisdom on the question of the extent to which people's behavior can depart from public health orders. Now, that can happen when people choose not to respect those orders, but it can also be the case that despite reassurances that a process is safe, people still feel a lot of fear or anxiety and decide not to trust that and prefer to stay home. So, that's relevant, obviously, in the case of the election, because if we do have one during the pandemic, I think there's some concern that people, even despite reassurances that it's a safe process, may elect not to vote because they just don't have that level of confidence. Do you think that there is a significant number of people who may choose not to vote, even if all the procedures are sound and safe, for fear of contracting COVID-19 if an election were held during the pandemic?
That would depend on, again, our key is always from the get-go is communication, and the public education. So if they were assured both by, if it's Federal Elections Canada, and then they would ask for input from the local medical officer of health to deal with questions and answers, to persuade them that it is safe and deal with all their apprehensions, that would be good. And then the other factors I introduced, where it is in the vaccination program, would also be a big factor. And the timing is going to be, has to be considered in that as well. So there's a number of factors to play in there.
Now, one of the things that's changed since we began this study is the promise of a vaccine rolling out in 2021. So obviously, on top of the work and strain that's already been in the healthcare system trying to treat people who have contracted COVID-19, now there's the logistical challenge of trying to administer the vaccine. Where do you think is the space and the capacity within the health system right now to do the kind of training that would be required on public health measures for an election? I'm thinking particularly of long-term care facilities where there's going to be, it's going to take somebody's time who has healthcare expertise to either help patients directly with the vote or to train people who normally are a volunteer there or who are non-medical staff who work there. Where do you see the capacity in the health system right now in order to be able to do what it takes to effectively deliver a safe election in the pandemic to all Canadians, including those in long-term care, in Indigenous communities, people living with disabilities who face additional barriers? Where do we find that capacity in the system right now when we consider treatment and vaccine rollout are making incredible demands on the current system?
Well, that's a good question. And one of the challenge we have in Ontario, and one of the benefits we have in Ontario that we've done very quickly from the get-go is to move it to first an all health type approach. So as a result, not just coming from my desk, but being at all the tables to bring all our deputy ministers involved, our minister, as well as our assistant deputy ministers, and all the different portfolios that some have, the Ministry of Long-Term Care, the Ministry of Seniors for retirement homes, and congregate settings under another ministry. So we have all wide government. So we have whole committees head up by the Secretary of Cabinet, which has all the deputy ministers. So there's various sectors of staff throughout the whole Ontario Public Services that can give advice and direction, including our intergovernmental affairs. So it doesn't all depend on public health people or hospital staff to do that kind of training. We've been trying to improve the knowledge base and guidelines and directions accordingly. So I think it would have to be, that's where you have to do the advanced training, as I said in my opening comments, to ensure that the people involved have received all the adequate training well ahead of time and was not left to the health system to do that, because these are well-known processes in place, and it's just a matter of documenting, scrutinizing, and putting your checklist in place so every setting has done what they're supposed to do at the right time, in the right way, and to assure us and the public that that is all in place. That's the advanced timing and training.
Thank you, Dr. Williams. Next, we've got Mr. Tucker for 5 minutes, please.
Yes, thank you very much. And to Dr. Williams, thank you for the good work that you're doing in Ontario. On behalf of Ontario residents, I represent riding in Saskatoon in Saskatchewan, but I know chief medical officers are very, very busy individuals. And I'd like to hear about a little bit on a typical day. What time does your day start at? And why I bring this up is I just want to understand on how busy you are and how a snap election might affect your work, important work you're doing in Ontario.
My day, myself, I start at 4:30 and doing stuff there. We have our first teleconference is at 7 o'clock. And then we have teleconferences and meetings from 7. That's why this one's juxtaposed. It was double booked with 2 or 3 others. So I'm taking the time out now. And so we have more and more. So a lot of it's communication. It goes then till 6 or 7. And then we sometimes have some follow-up calls and phone calls into the evening, and then reviewing the data, sometimes late at night, or drop in the night, you get to look at some emails by staff sending some things at 2 a.m. So you're trying to follow some things on that. So it is busy, and there's lots of people involved.
Well, I'm very grateful for the good work that you're doing, and I apologize if we invited you to this committee and you're double booked and you could be doing another call that could actually save lives that are out there, or communicating the rollout plan for the vaccine in your province. Or we all want this to end, and hopefully you're not going to be staying up until past 2 every night for the foreseeable future. But if there was an election, though, another thing that you'd have to do today would be to go vote. Perhaps if the voting day was today. So another way that you would be removed from the important work that you're doing. But speaking of if there is a snap election, what role should you have in consulting with the Chief Electoral Officer of Canada, coming from a province that you probably know the best about what's going on the ground, but what role do you think you should have in consulting with him?
Well, I think our first role is that I assume that the officer would access us through the Special Advisory Committee of the Public Health Network, through Dr. Teresa Tam, to give us updates and to deal with some things we may have the same questions from all of us in all the provinces and territories. So we cover those as effectively and efficiently as possible. And communications and updates could flow on that basis there. And then specific issues could be drawn forward. And then we look through our internal government affairs office to connect up as well, to make sure that we were consistent with our communications. And there may be time when we have to have special ones if there were some unique challenges that they would deem had to be handled in Ontario that were distinct and different from the rest of the provinces and territories. So it's going to be a bit iterative, and then using the time as effectively and efficiently as possible.
Mm-hmm. So somewhat the structure would be it would flow up to Health Canada, your input or your concerns, and then Health Canada would interact. If I'm hearing you right, that's kind of the role that you can see yourself in.
That's correct, because they could filter those and making sure that it's the best efficient use of time and communications going out accordingly.
Appreciate that. And I know my time is limited, so just quickly here, I'd like to get into what would the challenges of rolling out a vaccination program during a snap election. You'd be fighting for communication and awareness with the public as parliamentarian or candidates are trying to do the same thing. What are some of the other challenges that you think that would happen for the vaccine rollout if a snap election was called?
People would have some questions if they're in the midst of the process, who had been vaccinated at that time, who has evidence or proof of 2 vaccinations and the time period to have immunity. Would they have the same detail of limitation to get access in? These are all things we're trying to address now. Even if you have been vaccinated adequately, do you have to go through the same scrutiny to get into a long-term care home? These different points, as that's going to be an evolving question we have to ask ourselves, even to say, if you've been vaccinated, we are finding some people may be swabbed and still positive. So they may not be getting sick, but they may be transmitting. So much to be determined.
Elections Canada employees should have the vaccine before we have an election. It seems like sense. If they're going to be interacting with the public, would that be a smart health policy, is that people administering an election have the vaccine so we're not spreading it?
I wouldn't say they're in our top priority list that we put out by our National Advisory Committee and by our federal group. So right now they would not be in the top tranche in that group. They still have their other methods of protection, as in masking, distancing, getting tested, and all that kind of stuff there. So where they would fall into as volunteers and groups, we'd have to get some further direction. And that depends if we're in the first quarter of 2021, second quarter, and third quarter. So it's all a matter of when we can do that, but they would not be in our list at this moment of top priority individuals to do, because we want to decrease morbidity and mortality at this time.
Thank you for your time. I'll cede the floor. And I just want to say thank you on your busy day with so many things going on to spend an hour with us. There's probably much more important things you could be doing that would hopefully save some more lives in Ontario. Thank you for all of your long hours. I apologize that we're taking you away from that important work.
Well, thank you. If you have to get me out of trouble with General Hillier, I'll let you know.
We will do our best. Ms. Pettypat-Taylor.
Thank you so much, Madam Chair, and I'll be sharing my time with, I was going to say Minister Turnbull, but MP Turnbull. I just gave you a promotion, but I also wanted to add my voice in thanking Dr. Williams and all of the public health officials for the tremendous work that you've been doing over the past year. We are really, truly grateful. My line of question is going to be very similar to Mr. Tucker, actually, and it's in the area of jurisdiction. During your opening remarks, you indicated that the province of Ontario have 34 public health units, and you've indicated, and as we know, that their role and their responsibility is for the public health in their specific jurisdiction. I'm wondering, with respect to that, what would be their role in the midst of an election with respect to providing public health guidance to Elections Canada, as we recognize that there's a variation across the country when it comes to COVID-19 cases, and we're just trying to wrap our head around the issue of jurisdiction as to who would provide that public health information to Elections Canada. And as committee members, we've had a lot of discussions with respect to that, and would like to get your take on that.
through the chair, our approach would be to have our general standards from nationally, then we'd roll those out to have that all 34 would have the same messaging come from my table or from the province. And then each health unit, the medical officer of health, would have to deal with any outbreaks or concerns about outbreaks and concerns in various activities within the elections process, whether it's campaigning or in the selection of sites, and see if there's any concerns and issues where the medical officer of health can override that and give out directions and orders to say, we need to alter it this way and this way under the umbrella of what we say in Ontario. They can go more granular if there's something unique in their respective jurisdictions.
So when you say they could override it, who ultimately has the power to override such decisions?
They, as I said, they have an umbrella. They can enhance above that, but they can't go below that. So they can't say we will go less than what the province allows. They can say, but in this setting here, because of, for example, access with certain, say, First Nation community groups coming in and urban to get that, they may want to have some stipulation to protect or to ensure there's things in place there. So they can always make it more protective as long as there's evidence and scientific data to support that step.
Great. And one final question, then I'll cede the floor. During your testimony, you also indicated in long-term care homes that staff, volunteers, and family members at this point in time must undergo testing before they can enter the home. Would you agree that it would be better to promote alternative voting methods as opposed to people going into long-term care facilities to access or to provide residents with their voting option? And I guess I'm making reference to either mail-in ballots or phone calls, or phone-in ballots.
I would certainly support that. As I said, where you could have essential visitors who know the individual, they can bring their ballot in and make sure they filled out and then take it and mail it on their behalf. So we have many methods. I would prefer doing that rather than having aspects right in the home.
Thank you so much, Dr. Williams.
Thank you, Madam.
Dr. Williams, thanks for being here today. Really appreciate the work that you're doing. I have a mother in long-term care here in Ontario and a major outbreak in my riding in a nursing home. So I have deep concerns about our residents in long-term care. I wondered, and we also heard from the Long-Term Care Association that there were quite a number of outbreaks. I wondered if maybe you could table the data on the number of cases across Ontario in long-term care for residents and staff. And include both private, nonprofit, and publicly run long-term care facilities. Do you think you could provide that data to the committee, not now, but after the fact?
I will check with the ministry to see if they can do that. I have the numbers for today. I just don't have broken down by all those categories. So I'll see if they can provide those by the different type of administration of the different institutions.
Thank you. And one last question. I know rapid testing is often talked about in political spheres as being a kind of a panacea, but we know, I think, based on some of the comments you've already made, that it is not, that there's a whole testing regime and many aspects to this. What is the main risk? Like, why is rapid testing not a panacea? Is it because of the false negatives that we get?
So any test has what we call sensitivity and specificity. And so we have to do the ratings of those tests. And then depending on that, you look at their positive predictive value, as well as the aspect of false positive and false negatives. If we are okay to allow that to occur, then the testing would be fine. If there's settings where we're very concerned and we don't want to miss it, then we'll have to do like repeat testing can overcome some of those limitations and then do backup with the PCR to ensure that. So we've done some, and so far, for example, with the PanBio, if we do repeat testing, we find the positive is good. It's the false negative needs serial testing to limit that impact.
Thank you, Dr. Williams. We'll get through the block and NDP questioning, and then we will have to transition into our second panel. So, Monsieur Terrien, 2.5 minutes.
Merci, Présidente.
Thank you, Madam Chair. If I understood, you said that with the by-elections, that experience didn't increase the number of cases significantly.
The evidence of a increase in the cases in those areas that was attributed by our local health unit that was monitoring the situation.
OK. Aidez-moi.
Can you help me understand more clearly with the by-elections, during the by-elections, were there any red zones? Was the pandemic quite high in those regions?
If I recall the dates correctly, it was in October. And I think, I'm not sure if it was any in November. We had those areas in the by-elections had so-called modified stage 2, and they transitioned to the new framework that put them in the red zone.
OK. Donc,
So they weren't in a red zone from the beginning.
Framework in place yet.
OK. Est-ce qu'il y a des choses
Would have things have changed had it been a red zone at the time?
Not really. We were still monitoring the number of cases and the rates and that. It would not change significantly our measures, but the red zone brought in earlier because we modified the template down even lower later on in November, and that meant the limitations on restaurants, indoor capacity, outdoor capacity might have had some impact on that. If people were having, say, an election campaign meeting, what you could have as far as a group gathering inside versus outside, that did get enhanced and then even further limited during the so-called gray lockdown zones.
OK. Moi, je tenais.
I wanted to thank you for your presence and congratulate you for your work. And without you, things would be much harder. Life would be harder. So I wanted to thank you for everything you do, for being here and being there for your citizens. Your work is very precious for us. Thank you.
I only represent a very large team, so many people involved. Everybody's doing their best.
Thank you. Mr. Blakey, please, 2.5 minutes.
Well, I want to add my thanks to the chorus of thanks for all the work that you and your team are doing. And I just wonder if you could help us drill down into the question of, let's imagine a particular long-term care facility that's an outbreak. And we want to ensure that everybody who's living there is able to vote during an election if that's their choice. We know that the healthcare staff there are likely already overburdened and stretched very thin. So helping patients vote on top of the regular duties is a real challenge. We know that in many cases, even the non-medical staff in personal care homes are stretched very thin at this time. We know sometimes certain long-term care facilities will have a roster of volunteers that in normal times would have been there to help with various kinds of tasks. Just wondering, where do and we know that many residents are going to need somebody there alongside them to assist them with the voting process. Even if they're able to procure a mail-in ballot, many may need help filling out that ballot. So what do you think is the best advice that we could give to long-term care facilities, to Elections Canada, in keeping with the best public health advice for where they should be looking to get that staff time or volunteer time or some real people that can go in and assist long-term care residents with voting in a way that protects their health and safety so they're not disenfranchised because we left it to medical staff who are already trying to do the impossible, just treating for patients. Where is the place to look? What's the best way to try and ensure that they have that help if they need it, and that help isn't people who, yes, are trained, but who are then trying to move from facility to facility because we can't replicate that expertise in each facility because that obviously would present some very serious health challenges as well. What can we do? I guess is what I'm asking.
So I think it's a matter of looking at the demographics and assessing each home. As you've seen in Ontario, we've tried to do, even during the lockdown zone this time, is instead of having no visitors, we have gone to the process of having essential visitors. So we hope that every resident has a registered essential visitor or visitors for them that have gone through the process of logging and being recognized, and they are doing the regular testing as well. But there may be some homes where there is no essential visitor and person linked to that individual. We'd have to look at how many people there were in that group who are, I guess, medically and mentally capable of voting. They don't have alternative decision makers, as in family members who could ask to submit those documents in. And then if there was a large number in some of the large centers, would you want to designate a, I don't know what your title could be, scrutiny or whoever, would go through the process of documenting, getting tested, and be able to go in at a certain time and undertake that and being able to access. So we'd have to think how that might work.
Is that
but that's
a
where there's no
realistic?
essential.
I'm sorry to interrupt, but I know we're short on time. Is that a realistic administrative burden for long-term care facilities right now? Particularly, like, you know, I'm in Manitoba. We're in full lockdown.
We're
there's
out
a
of time, and
yeah.
Unless you have a quick yes or no for that.
I'd say it's difficult, and that's why we have the Essential Visitor Program in Ontario.
Okay. Thank you, Dr. Williams, once again. Of course, as all of the members of the committee have thanked you, I as chair, and I'm sure everyone that is a part of putting this committee together thanks you and the work that you have done, I think, as a federal government, and I'm sure all the provincial governments, they really do realize that public health needs to be adequately resourced and respected, and you have done tremendous work, and thank you for that. So we will switch in to the next panel, and I will suspend for about a minute just to do the sound checks that are needed and come right back. Get started, and just to make sure, I wanted to just remind everyone to ensure that they are in gallery view, and in order to do so, you can click the view in your right hand top corner so that everyone can be seen. I'd like to make a few comments for the benefit of the new witnesses. Before speaking, please wait until I recognize you by name. When you are ready to speak, you can click on the microphone icon to activate your mic. A reminder that all comments should be addressed through the chair. Also want to remind you that the mics are not going to be controlled automatically, so to please put yourself on mute afterwards as well. And interpretation in the video conference will work very much like in a regular committee meeting. You have the choice at the bottom of your screen of either floor, English, or French. Floor would be for those that are fluent in both English and French, so you could choose that. When speaking, please speak slowly and clearly. When you are not speaking, your mic should be on mute. And the use of headsets is strongly encouraged. I'm hopeful that you guys got the authorized headset set from the clerk. That's great. I see all of you with it. Thank you for that. And now I'd like to formally welcome all of our witnesses to today's committee meeting, the first on the prorogation study. And I'd like to welcome Professor Daniel Chirp from the University of Montreal and Professor Philippe Lagacé, Professor Carleton University, and Professor Kathy PROC, Professor of Policy Studies from Queen's University, and Professor Barbara Massamore, Professor in the History Department at the University of Fraser Valley. I'd also like to, right at the offset, apologize. I know that at least one of the witnesses was sent communications that were only in English, and that was definitely an error on our part and our team. So I apologize for that, and we will try to do our best to make sure that that does not happen again. So my apologies. And just like mentioned before, interpretation services are available throughout this meeting. So that there should be no problems in the meeting today. Each of the witnesses will get a 5-minute opening statement. And so let's have a start with Mr. Chirp, please.
Bonjour, Madame la...
Thank you and good afternoon, Madam Chair and ladies and gentlemen of the committee. And this is actually the International Human Rights Day, so I don't know if Parliament will be underscoring that event, but it's been 72 years since the United Nations adopted this Universal Human Rights Declaration, where they do talk about political rights in democratic society. So I just wanted to point that out. Now I'd like to thank you for the opportunity to participate in your study. I have read the report entitled August 2020 Prorogation Pandemic of COVID-19, in which the government sets out its reasons for proroguing Parliament on August 18, 2020, and setting the opening of the second session of the 43rd Parliament for September 23rd, 2020. Now, to contribute to this debate, I would like to comment on the prorogation decision by speaking to you about prerogative, hypocrisy, and democracy. So first on prerogative. The prorogation of the 43rd Parliament of the House of Commons was decided by the Government-General of Canada on the advice of Prime Minister Justin Trudeau in the exercise of a prerogative. This has been presented as having its source in a memorandum concerning certain of the Prime Minister's duties that was adopted on October 25th, 1935. And I've actually added that to the appendix. That is the official version, but only available in English, I should point out. I was not able to find a translation of this. Now, what's interesting in this memorandum is that there is mention of what does fall under the special prerogative of the Prime Minister. And what is mentioned is dissolution and convocation of Parliament, but there is no mention of prorogation in that memorandum. So I wanted to bring this to your attention and ask you to ask yourselves whether or not this prorogation is actually a special prerogative of the Prime Minister, because in that memorandum, they only point out convocation and dissolution as that prerogative. So Justin Trudeau is not the only one who has prorogued Parliament. Stephen Harper did as well, as have other Prime Ministers. Now I'd like to speak to you about hypocrisy. And I'm sorry I'm using this term. It's a harsh term, but in the report, which explains the reasons for the recent prorogation, it's clear that the reasons being provided are actually difficult to identify. I read it and I found it hard to figure out what the reasons were for proroguing. But from what I understand and what appears to be in the report's conclusion is this, and I'm quoting from the report: "Given the challenges before us, the lessons we had learned from the first wave, and the hard work that still lay ahead, it was very clear in August that we needed to revisit our agenda and gain the confidence of the House to move forward." So I suppose there are two reasons being given, and they're put in terms of the obligations that the government seemed to want to impose on itself, that is, review its agenda and obtain the confidence of the House. However, I would question why prorogation was necessary to revisit their agenda. The government can do that any time. It can do so in a speech from the throne, for example, without even proroguing. And it can continue to respect the sittings of Parliament without necessarily proroguing. Now, with respect to the confidence of the House, on August 18th, 2020, the House had the confidence of the House. So that is not a real reason. Actually, it's not a valid reason. Now, we know what the real reasons were. Some may have difficulty in admitting this, but the reasons were to put an end to the existence and mandate of the 4 committees that were studying the We Charity affair. There were 4 of those committees, as I said. The Finance Committee, the Government Operations and Estimates Committee, the Access to Information Privacy and Ethics Committee, and the Standing Committee on Official Languages. These reasons aren't mentioned in the report, and therefore the report is not a demonstration of transparency, but rather a sad example of hypocrisy. My last point will be on democracy, because I do want to draw your committee's attention to a very important ruling, the ruling of the Supreme Court of the United Kingdom of September 24, 2019, which spoke to prorogation. And in the case of Brexit, the court said that prorogation could not be used as a rule if it was going to frustrate the conventions of parliamentary sovereignty and democratic accountability. And this ruling should have an impact as well on decisions that are made in Canada, because prorogation should not prevent Parliament from continuing its work as it did in the case of the We Charity affair. Thank you, Madam Chair, and thank you, members of the committee.
Am I pronouncing your name correctly?
Yes, Madam Chair.
Okay, thank you. Go ahead, 5 minutes, please.
Thank you. Thank you, Madam Chair. Thank you as well to the members of the committee and the clerk for inviting me to appear before you today. On nous a demandé d'aborder la...
We've been asked to address the government prorogation this past fall. So to do so, I'm going to begin by explaining what purposes prorogation serves. I'll then note how prorogation can be abused before outlining criteria that I believe are useful for judging the acceptability of particular prorogations. And thirdly, I will apply these criteria to the fall 2020 prorogation. Lastly, I will conclude with thoughts on how we hold governments to account for improper prorogations and whether we should encourage Canadian courts to limit the scope of the prorogation power, as they did in the United Kingdom.
Is it necessary to end a parliamentary session and begin a new one? A prorogation may be wise or necessary to serve the following purposes. There may be a change of ministry within a parliament, requiring a new government to lay out its agenda, clear the slate of legislation so that it can enact its own bills. Parliament may have been in one session for an extended period of time and the government wishes to start afresh. A significant event leads the government to want to pursue a new slate of legislative measures, or a government wishes to put forth a new parliamentary agenda in anticipation of a general election. Bien entendu, étant donné les effets de la prorogation.
Of course, given the effects that prorogation has, notably terminating government bills, clearing the order paper, resetting committees, and often erasing sitting days, this power can and has been used as a hardball tactic, one that allows the executive to stifle the opposition's ability to hold it to account. For example, tactical and/or hardball prorogations can be used to avoid or delay a vote of no confidence, reset committees that are mounting an inquiry that is politically harmful to the government, avoid or delay parliamentary proceedings employed to hold government to account. And we could always go into that in more detail.
Damages our constitutional norms and democracy. How then do we distinguish between acceptable, purposeful prorogations from damaging tactical ones? Length is one distinguishing factor. So prorogations should be as short as possible. And although Canadian practice has been to have relatively long prorogations, we should be aiming to shorten their lengths, particularly given the increasing questions that surround this power. Next is the political environment. Are committees holding inquiries that are embarrassing to the government? Is there a vote of no confidence looming? If the answer is yes to these questions, we can be forgiven for assuming that the prorogation is tactical. A third factor is the parliamentary setting. Has Parliament been sitting often or sparingly? Has the government been subjected to consistent parliamentary scrutiny, or has it been avoiding it? The less active a parliament has been prior to a prorogation, the more suspect the decision to prorogue. Sur la base de ces critères,
based on these criteria, how can we evaluate the fall 2020 prorogation? Clearly, the pandemic represents a significant event that led the government to want to reset its legislative agenda, its budgetary posture, and policy priorities. And this suggests that the prorogation had a legitimate purpose. On the other hand, the prorogation was unnecessarily long. It reset committees looking into an issue that was embarrassing to the government. And most importantly, from my perspective, it paused and restarted a parliament that had already sat for far too little time and which was already poorly placed to hold the government to account since the pandemic began in earnest. These factors weigh in favor of a tactical prorogation. To conclude then, how do we hold governments to account for tactical prorogations?
Answer. The reality is that we rely on politics to hold governments accountable here. It is up to the opposition to criticize the tactical nature of prorogation, for the government to explain why it believes it was purposeful, and ultimately for Canadian voters to decide who they side with. That said, the United Kingdom provides us with another possibility, asking courts to invalidate prorogations that prevent Parliament from fulfilling its constitutional functions without proper justification. I would strongly caution against Canadian courts following this precedent. The line between a purposeful and tactical prorogation is rarely clear, and in some cases, the government will engage in tactical prorogation in response to equally questionable behavior on the part of the opposition. The acceptability of a prorogation should, in my view, be viewed as a non-justiciable political question that can only be answered in the political arena. Thank you, Madam Chair.
Thank you. Next, we've got Professor PROC, please.
Hello to everyone. Thank you very much for the invitation to appear. Je dois parler en anglais.
I will be speaking in English because my French is not good enough to be able to do this, and I will speak too slowly in French.
Okay, so thank you for being here. I've been asked to speak about the government's constitutional legal powers in the context of our governing system. So I will talk about the foundations, then the legal basis and constitutional basis, as well as the conventional basis, constitutional, for prorogation. A little bit about some parallels to what has actually just transpired this year, and then I'll conclude with some remedies. So you have my notes. I will be summarizing them fairly quickly. So to begin, the heart of democracy in Canada is Parliament. It's fashionable to deride Parliament, to downplay its importance, but Parliament has truly stood the test of time in ensuring transparency of government actions, accountability of the government to the people, and acting as a voice for Canadians, just as the founders envisioned. While prorogation is often derided as a political tool, closer examination, I think, situates it as an important aspect of the relationship between the executive and legislative branches of government. As we know from the Supreme Court, Parliament is sovereign, and the executive and the courts should respect Parliament as a primary institution. Core strength of the Canadian political system is that the executive is strong, it's able to execute its agenda, it can act quickly, decisively. Now, the support of the House of Commons is important to the executive and to ensuring that its agenda gets through. That is one of the first functions that the House of Commons must do, is to support the government. But to ensure the government does not become too powerful, Parliament has a second important duty, and that is to hold the government to account, as you are doing by reviewing this report. By confronting the government directly, the House of Commons shines a light on instances of questionable or poor judgment and offers alternative views or scenarios so that Canadians can decide whether they'll keep or fire the government in the next election. By performing this duty, the opposition parties, but the House of Commons generally, helps ensure governance is not only undisrupted in Canada, but also that it's transparent, good governance during both normal times and crises. Prorogation embodies these fundamental aspects of the relationship between the executive and Parliament. It's a more refined tool than the blunter one of dissolution, which, as you know, dissolves Parliament and forces an election. Prorogation pauses the work of Parliament rather than halting it, and so it keeps government working, and that's important. You've heard that prorogation does have two components. It suspends the work of Parliament by ending its current session, and it resets the parliamentary agenda with the start of a new session and throne speech. In Canada, prorogations have been short as a few hours, and they can go up to the constitutional limit of 1 year. The norm is usually 40 days, or the Prime Minister requests an extension. Prorogation is derived from the common law prerogative powers of the Crown under the Westminster model of parliamentary government, but we have a uniquely Canadian twist to them. Section 38 of the Constitution Act 1867 says that the Governor-General from time to time, in the Queen's name, by instrument under the Great Seal of Canada, will summon and call together the House of Commons. This has been interpreted to include prorogation and dissolution. By virtue of the letters patent in 1947, the Governor-General is authorized and empowered to exercise powers of the Crown with respect to summoning, proroguing, or dissolving the Parliament of Canada, and by convention, this power, the power to advise dissolution and prorogation, lie with the Prime Minister. So on to the power itself. It's complex, it's controversial, in part owing to the fact that it's largely governed by conventions. Under the Conventions of Responsible Government, the Governor-General acts under the direction and advice of ministers who are members of Parliament and collectively hold the House of Commons. This ensures that the government is beholden to the legislature at all times. If the advice tendered by Cabinet is lawful and constitutional, then the Governor-General is obliged to accept and follow it. This ensures that the head of state is ultimately accountable to the citizens through the government and Parliament. The Prime Minister, as head of government, is responsible for the decisions of the Governor-General, and this is important because it keeps the Governor-General above the political fray and keeps that office impartial. Things become trickier if the advice is unconstitutional or unlawful, or if the government does not hold the confidence of the House. In these cases, the very first responsibility of the Governor-General is to advise and warn the Prime Minister of this possibility, and the first remedy rests with the Prime Minister and government. Matters become murkier if the government presses forward. If the remedy is unavailable and the advice contravenes the Constitution or legislation, then the Governor-General can refuse the advice or defer action. In the second case, whereupon the government is unable to proceed with its agenda in a deadlocked Parliament, then the first and preferable remedy is for the government to accept this responsibility and advise the Governor-General on the best way out of the deadlock. In this case, prorogation is a less drastic decision and course forward than dissolution and an election. A pause in the work of the House may allow passions to subside and a reasoned debate to take place after prorogation and I can cover the rest of my remarks in the question and answer period.
Thank you, Professor PROC. That's why I was trying to get your attention. Also, there's some popping happening. I think your mic is a little bit close to your mouth. So for the question and answer period, if you can just move it an inch away, and I think we won't have that popping. Next, we've got Professor Massey Moore, please. You are still on mute. You need to click unmute. It should be.
Got it.
Yeah.
Thank you. Yeah, I got it. Bear with me a moment. Here we are. Thanks for the invitation to appear. I'm an historian with an interest in political and constitutional history, particularly the role of the Canadian Crown. Prorogation and dissolution of Parliament are among the Crown's prerogative powers. Prorogations throughout Canada's history have seldom attracted attention, and the term wasn't really part of the general vocabulary. To the extent that it was more apt to be understood as a routine procedure to end a parliamentary session. Similarly, in the UK, annual prorogations have been the norm, although Prime Minister Boris Johnson's 2019 request amid the Brexit deadline suddenly brought prorogation into controversy. In majority governments, controversies over prorogation are rare. I'm currently at work on a book on the 1921 federal election. The advent of the Progressive Party gave rise that year to Canada's first post-Confederation minority government. That's also a link in the chain of events leading to the famous 1926 King Byng constitutional controversy over the Governor General's refusal of advice for dissolution. The fact that Canada had a long run of majority governments from 1979 to 2004 meant that there were fewer opportunities for prorogations to be used in a way that excited controversy. At times, however, it was arguably a tactic to evade probes of wrongdoing. This has been alleged of the 2003 prorogation as details of the sponsorship scandal emerged, although media or opposition attention at the time was seldom directed at prorogation per se. A new level of scrutiny followed after December 2008, when prorogation was used to stave off a non-confidence vote in a minority government situation. At the time, I wrote that the Governor General was correct in following the Prime Minister's advice for prorogation. It seemed apparent that the prorogation was indeed intended to derail the planned NDP Liberal coalition that sought to govern with Bloc Québécois support. But for the Governor General to refuse the advice of the Prime Minister, who'd not yet lost a confidence vote, would have been a very serious step, used only in the gravest emergency. The opposition was delayed, but not prevented from having an opportunity to withdraw confidence from the government. When Parliament resumed in January 2009, it chose not to do so. At the time of the 2008 prorogation, I wrote about another long ago controversial prorogation at the height of the Pacific scandal in 1873, with John A. Macdonald rapidly losing support in the House of Commons. He requested that the Governor General prorogue Parliament. While that ended the investigative committee, it didn't end the controversy, and Macdonald resigned when Parliament resumed a few weeks later, Dufferin then calling Liberal leader Alexander Mackenzie to form a government. The 2008 controversy over prorogation has made any use of this procedure a matter for greater scrutiny. The use of prorogation in December 2009, which had the effect of suspending a committee investigating treatment of Afghan detainees, attracted particular attention as a result. Standing Order 32.7 would seem to make the scrutiny a permanent condition. Canada's 42nd Parliament, we know, consisted of only one session, a rather unusual situation given the 4-year life of the Parliament, so no prorogations were sought to end sessions in the usual way. In the past, some full-length parliaments have had only 2 sessions, although this was unusual, and some have had as many as 7, but about 4 sessions was more the norm, meaning prorogations would be a regular occurrence. The most recent prorogation of the 43rd Parliament in August 2020 had the unfortunate effect of interrupting the committee in scrutinizing the We Charity controversy, something that requires further investigation. That said, there's also a strong case that can be made that the unforeseen eruption of the COVID-19 crisis since the start of the 43rd Parliament provides a rationale for a new session with a new speech from the throne setting out a fresh legislative program. For this reason, I think prorogation was entirely justifiable. Thank you.
Thank you so much, Professor. Thank you to all of you for your concise and interesting remarks. We'll start with our first panel, and that is Mr. Doherty with 6 minutes, please.
Thank you, Madam Chair, and thank you to our witnesses today. On August 18th, Prime Minister Trudeau chose to prorogue Parliament for a term of 6 weeks. At that time, there were 4 parliamentary committees that were studying what has been classified the WE scandal. That is, the WE scandal deals with the government awarding up to a $900 million contract to what we all know now, the public knows, that there were very close contacts to both the Prime Minister and as well senior cabinet ministers. I find it very interesting, and I do appreciate the comments that we've seen from our witnesses, and I think that what we've seen when we came back, that there was indeed not a reset. We saw that there were more committees that had tried to study this prorogation that were filibustered, continued to be filibustered. This is the only committee that we've eventually tried and successfully gotten to study this. I would urge our witnesses today, we don't know what the future lies ahead. So be as forthright as possible in your answers, because this may be the only time that Canadians actually get to hear other perspectives on why this prorogation took place. Dr. PROC, in an August interview with the Kingston Whig Standard, Mr. Garrettson's hometown newspaper, you said, and I quote, "Although you can understand the delay, the continued state of suspension with respect to a budget is troubling. I find the proroguing of Parliament quite troublesome." Dr. PROC, we still sit almost 2 years without a budget. Can you elaborate on what troubled you the most?
Sure. Thank you very much. Am I still popping, or is it okay?
No, you're good.
Okay, thank you. Well, there are 2 issues here for me. First of all, the question of the committees, and you'll see in my notes that I provided, one of the things that I recommend Parliament do, because it cannot actually put restrictions on the Prime Minister or the Governor General with respect to the power of prorogation without a constitutional amendment. But what it could do is look at how it operates when prorogation is called. There have been some exceptions to the business of the House of Commons that have been covered by prorogation, and I'm wondering if committees should be one of those things that you consider. The reason why is because if we look at 2009, which I thought was much more troublesome than 2008 prorogation, or the experience of the McGuinty government in Ontario, when a government is seen to be avoiding tough hearings by committees and it prorogues, that really does create disillusionment among the public, cynicism, and can lower the legitimacy of the government and our political institutions, but also it makes Parliament look like it's less effective than it should be. The second point would be about the budget, and I find it very troubling that we have not had a budget. That is one of the best means for the Parliament to hold the government to account and to scrutinize what it is doing. It provides stability and continuity. The primary function of Parliament is to approve the funds of government and to check how those funds are spent. And without a budget, it's very difficult to do that. In my work with the public sector, I'm also asking people in the public sector how they are affected by there not being a budget, because I think it is an important measure.
Thank you, Dr. PROC. Dr. Lagasse, in an August op-ed, you wrote, and I quote, "The fact that committees holding hearings into the We Charity will no longer be meeting is significant. Whether this is a fair characterization depends on the government's ability to show it was necessary. In your opinion, in your view, did the Liberals subsequently show it was necessary to shut down Parliament?"
In my honest estimation, I would say that no, I don't believe that the reset was effective in communicating the necessity, which isn't to say that it might not be there, but the communication that was put in was not convincing to me. And in particular, I would say it might have been more convincing had Parliament been sitting on a regular basis throughout the summer and throughout the crisis. And I think it's the compounding of factors that makes it more difficult, to be quite frank, sir.
You conclude in your op-ed with the observation that, quote, "Preventing improper prorogations depends on making them politically costly." How, in your view, would that be achieved?
Well, to be frank, sir, it's this is really your business, not mine. I can point them out in the public domain, but this is a political accountability system. And as I mentioned in my remarks, I don't believe that we should be relying on the courts to do these types of things, precisely because, as has been noted by some other witnesses, we will arrive at different conclusions about whether or not the propriety of this action. And by the same token, you can make a case, as my colleague Professor Messamore just said, that you may come to the conclusion that it was an appropriate reset. I think it really depends on in the eye of the beholder, and ultimately it falls upon yourselves as members of the opposition to convince Canadians otherwise.
How much more time do I have, Madam Chair?
You don't have much, no. Time is up.
Thank you.
You think you heard the bell ring just now too. Okay, next we've got Mr. Alghabra, please, 6 minutes.
Thank you very much, Madam Chair, and good afternoon and good morning to our witnesses. Thank you for being here today. I'm going to focus, maybe I have a bunch of questions, and because of the limited time that I have, so maybe I'll ask Dr. Messamore my questions. And some of you might be surprised, some of those questions may not be part of your expertise, but here we go. When was the last time we had a global pandemic?
The one that comes readily to mind is 100 years ago.
Right. Do you know how many Canadians were infected by COVID?
By COVID or by the last pandemic are we talking?
No, by the current pandemic.
Yeah, these are not my
so it's
areas
just
of expertise at all.
About 440,000 so far.
Okay.
How many Canadians have died because of COVID? Do you know?
The exact count? No, I don't. No, it's not within my.
Again, the latest numbers are over 13,000 Canadians. Do you know the decline of the GDP of the Canadian economy?
Again, not my area.
It's close to 40%. I'll also say that the unemployment has more than doubled to almost 14%. So here's a question for you. Do you see the drastic change of the conditions of the country from the first speech from the throne after the government was sworn in December of 2019 to today?
Well, yes, and that's kind of my point, really, that I think that I was recalling the British Prime Minister Harold Macmillan's question by a journalist about what blows a government off course. And he said, events, dear boy, events, right? And I would say this is very much a case where events have overtaken the original speech from the throne. And I absolutely get that the suspension of the investigative committee is a problem. And I think Professor Lagacé's point about there being a political cost is well taken. Since we've had this greater scrutiny of prorogation, people take notice. People who never understood the term or thought anything about it, it's become a sort of a flashpoint when you hear that word. And yes, there is a political cost, but I think that it is unusual to carry on a parliament with one session.
Just because I have a handful of more questions.
Yeah.
And I agree. Ideally, the committees should not have been interrupted. But given this drastic changes of the circumstances and the need for a brand new agenda for government, I think one can weigh the the pros and cons of this. Question for you: have you been following the 4 committees that were studying the WE situation prior to prorogation? Do you know how long they were studying the situation, the WE file?
No, not specifically. No.
So just again, for your sake and for Canadians' sake, over almost a month and a half, these committees have been holding hearings repeatedly and have invited many witnesses, by the way, including Prime Minister, which was unprecedented. Do you know if committees can, after the prorogation, can still continue those studies if they choose to?
You mean during the prorogation?
No, after.
Yeah, no, I mean, this is the end of the committee's...
once committees are reconvened, if they can choose to...
Oh, I see. Yes, I mean, my understanding is that a different committee would have to be formed.
Right. Okay. So, I think you can catch my logic here is that while perhaps there's unfortunate pause to some studies, even though those committees had been doing their work for a very, very long time and have interviewed so many witnesses, I think that on balance, perhaps this was necessary. The last question for you: has any other government in the past submitted an explanation to the House of Commons for its prorogation?
My understanding is that the procedure is a comparatively new one, so I think the answer to that would be no.
Okay. How much more time, Madam Chair, do I have?
You have just a little over a minute.
Okay, I'll stop here. Thank you.
Okay, Mr. Therrien, 6 minutes.
Just a quick point of order, if I may, Madam Chair. I know Mr. Alghabra had a lot of questions outside the subject matter expertise of our witnesses, but he seemed to have the answers. I wonder if Mr. Alghabra would like to be called as a witness for the study.
I would love that. Please. Please. Thank you, Daniel.
Okay, so we will carry on with sorry, not Monsieur Therrien. Of course, I did notice you were here, Madame Normandin. Thank you so much for being back with us. We always love it when you pop by. Go ahead, 6 minutes.
Merci beaucoup, Madame.
Thank you very much, Madam Chair, and it's a pleasure to see all of you as well, and Professor Daniel Turp. And I will be asking him most, if not all, of my questions. Professor Turp, I'd like to ask you this. Are there any examples of other situations where a prerogative was used by government to avoid accountability or avoid any closer look at any, for example, allegations of corruption? Well, my colleague Barbara did provide a few relevant examples in Canadian history, especially that 1873 example of John A. Macdonald, where he tried to avoid an inquiry into a scandal. And that really was an attempt to use prorogation to end and avoid parliamentary scrutiny of an issue that dealt with corruption and the use of public funds. So it's not very difficult to draw a parallel with what happened a few weeks or months ago, because the We Charity affair also deals with investigations, parliamentary inquiries, as the member who just spoke referred to, and the Conservative member just spoke to. There were 4 committees trying to find out what was happening in this affair, how public funds had been used, if they'd been correctly used. And there are other examples that don't necessarily have anything to deal with corruption, but for example, detainees, Afghan detainees, which was another example that was quoted. Thank you very much. I'll come back to the reasons this government gave for proroguing, but I would like to ask you this first. In other democracies like Canada's, are there examples where the courts intervened in order to rule on the legality or not of parliamentary prorogation? Well, it has happened very infrequently. And my colleague Lagacé doesn't think that courts should be involved, but I disagree with that position, especially in light of the UK Supreme Court's ruling around Brexit. A court there unanimously, and sometimes it's difficult to get unanimous rulings, but this was unanimous on a constitutional issue that was complex. And this court ruled that it had to set parameters that had never been set before by a parliament. So I think that we should look to that model. And if action had been taken during the prorogation, this precedent, this UK precedent, would have been of interest, would have had implications. And who knows what the Canada's Supreme Court would have ruled. But one might think and assume that it was going to use the same principle and declare the prorogation as being illegal, as the UK Supreme Court did. Thank you very much. So there can be a legal framework to this, but could it be done under our laws, under our Constitutional Act, for example? Do we need to make constitutional changes for that? Well, yes, we are going to have to revisit the Constitution, obviously. No one can conclude that governments have not abused the use of prorogation during the very birth of our Constitution. In 1873, it already happened, and here we are in 2020. There have been too many examples of abuse of power to avoid inquiries, avoid a closer investigation or scrutiny, avoid non-confidence votes. Now, if we want our democracy to be a healthy one that protects Parliament and its sovereignty as well as democratic rights, including yours as members of the committee, then there are going to have to be changes. Now, should it be constitutional reform, as my colleague has suggested, or could it be reforms elsewhere that would help frame this power? Well, it can be done because convention can be changed. Conventions can be changed with new conventions and usages. And I think it would be very useful given what happened in the most recent prorogation, because in my opinion, that was an absolutely unacceptable prorogation and adequate reasons were not provided, even if it is the first report on prorogation reasons that some people are boasting about. But it's not clear at all. The reasons aren't clear, but we know what those reasons were. Well, yes, that report is now mandatory. Now, given the reasons that were outlined in the first report, was 6 weeks necessary? Because the prorogation lasted some time. Well, I feel, as others do, that this prorogation was too long and it was unnecessary, perhaps contrary to Mr. Lagacé's opinion. But, programs could have been continued. We all know how speeches from the throne are prepared. They can be done quickly. It can be done overnight even. And so in this case, I don't think that length of time was necessary nor useful. The only reason this prorogation was undertaken, and this is not mentioned in the report, by the way. Other reasons are provided, but the real reason was to avoid continuing the work of those 4 parliamentary committees. And I'm sorry, but a month and a half is a very long time. It is a long time, but it's not a long time in the life of a parliament.
Thank you, Professor Terp. Mr. Blakey, 6 minutes, please.
Thank you very much. I think I'm going to start by providing some comments. In particular, I do want to say that one of the things that I personally find frustrating about the nature of this prorogation and some of the prorogations under the Harper government were that, and as we've heard some witnesses say already, there is an important routine function of prorogation and it can be used properly. I found it odd that we never saw the end of a parliamentary session in the last parliament and felt that that was based on, frankly, just a kind of ignorance of what prorogation really meant. I think that ignorance persists, and what we saw was a government who, not understanding the proper function of prorogation earlier this year, decided to use it and abuse it, frankly, as a tool. Not only did that mean that an important investigation on the We Charity scandal was prematurely terminated, not only did it mean and has continued to mean, in spite of prorogation, that we're not getting a budget, which I do think is important. And we saw that the government is able to speak to its fiscal situation, notwithstanding the challenges of the pandemic, and therefore I think could present a more fulsome budget. But it also meant that in that period of time, and I would say this is perhaps to Mr. Terp's point, or Professor Terp's point, that can feel like a real, a month and a half in some ways is not a long time. In other ways, it's a very long time. That was a long time for Canadians who were on the Canadian Emergency Response Benefit and were waiting to see legislation tabled in the House to get a sense of what was coming for them at the end of September. And the fact that we weren't able to make progress on that issue, and that the whole thing was decided within the space of a few days because the government hadn't left time for them to table legislation to allow a proper conversation to happen, meant a lot of stress and anxiety for Canadians who knew that the deadline for CERB was coming up and didn't know what was going to replace it. And that's the truth. People didn't know. It came right down to the wire. And that was another, as far as I'm concerned, shameful aspect of this prorogation, which was not a proper use. So that's my opinion. Let there be no doubt about it. I take the point that this is an exercise of political judgment. But I also think it's important when we talk about the various levels of or divisions of power within Canadian society, that we recognize the importance of the legislature, which is far too often passed over in the context of the Canadian system. I find it frustrating that we would need a constitutional amendment to do what some other countries do and rightly do, which is to require a 2/3 vote of the legislature in order to dissolve, or I think also it should be applied to prorogation. Now, in other fora, not here today, but if you look at some of the testimony from the Special Committee on Electoral Reform, one of the subject experts, Professor Hugo Cyr, provided a brief that talks a bit about the power of prorogation and proposes that although we can't actually make it binding that there should be a parliamentary vote for dissolution or prorogation, one of the things that might be within the purview of the House to do would be to put in the standing orders that if a Prime Minister recommends prorogation or dissolution without having a vote and the consent of the House of Commons, that Prime Minister would be deemed to have lost the confidence of the House. And I'm wondering, we have 4 experts on the matter here today, if we could get a little bit of feedback on that idea, or what other mechanisms that would not require a constitutional amendment would allow Parliament to assert its authority and demand that it be consulted on questions of either prorogation or dissolution. So I'm wondering,
2 minutes.
We have 2 minutes, so perhaps we could start with Professor Messamore on that point, and others can jump in as they see fit.
Well, I agree that there is certainly there are other Westminster system jurisdictions that have kind of looked at ways to put in place some sort of rules. I mean, I think it's also important to get that. I think when we start looking at reasons and things like this is always going to be politicized, right? So, the report that some found unsatisfactory because it failed to address some of the things. I mean, this is one of the things when we attempt to make things more transparent that often it really doesn't have that effect. There's the question of the prerogatives of the Crown, and there's some debate about whether or not prorogation is, it's a prerogative power, but is it a reserve power? And I think most people agree that it is. In other words, that the representative of the Crown does have some leeway in refusing, in extreme circumstances, a request that, or perhaps saying we don't not refusing the prorogation, but insisting on a shorter period of time. Yeah, that's one consideration too, that prerogative of the Crown. I think since time is so short, I shouldn't take all the time here.
J'ajouterais, Monsieur le député Blake.
To Mr. Blakey, I would say that a solution has to be found. Perhaps it won't be a constitutional solution because it's quite complex to have to amend the Constitution. However, I think that any responsible parliamentary member should try and initiate something that better frames this power, because this is a prerogative that has the use of which has been abused, and perhaps your committee could undertake some kind of comparative study and look at what solutions have been found elsewhere, because a solution is required. The Prime Minister has so much power in this country, and that power has to be limited.
Next, we've got Ms. Vecchio for 5 minutes, please.
Thanks very much. And it was we've commented a lot about and the fact that these committees were sitting, but I also wanted to indicate that there were some other great work. There was a lot of other great work that was being done in other committees. I happened to be the chair of the Status of Women at the time, where we were studying about the impact of COVID-19 on women. We know that they were looking at, we talked a lot about racism, and in the Committee for Public Safety, they were talking about policing and racism. There are so many committees. We talked about the 4, but we recognized that all committees were doing great work, but it seemed, of course, that the public really did catch on to the WE scandal, because this was something that was impacting Parliament. And so I look at this thinking, we talk about all the work that was stopped, and we have come back to Parliament with having to rush pieces of legislation through because of this time frame that was taken off by the government so that they could adjust whatever their policy may have been, although I've seen similar bills just tabled each and every day. I wanted to start off with a question for Dr. PROC. You indicated in one of your quotes, "As a political scientist, I'm fascinated by the strategy. I have to concede I would probably advise them to do what they're doing." Your choice of the word strategy is very interesting. Could you elaborate on that choice of word?
Sure. And just to preface my remarks, I've advised 4 of the parties that are currently in the House of Commons now at different levels of government. So I am nonpartisan on this. Quite frankly, 2008, 2009 to 2020, I would have, if I had been a strategist for the government, advisor to those governments, I would have suggested prorogation.
And was that because, is that because of needing to set a reset, or was that basically with the strategy seeing that the temperature of where we were here in Parliament in July and August?
2 reasons. One, yes, to reset, but also to emphasize what the government priorities are in a changed circumstance, or if they're getting lost in a political debate that is starting to go ahead. Secondly, if you look at 2020, this was a government that was tired. This was a government that was under a lot of pressure. This is when a government makes very serious mistakes and they're exposed to the public as failures of government or malfeasance or misdemeanors of some type, when in fact they're due to errors of exhaustion. This gave the government and the public sector time to regain their
strengths. Okay. Thank you. I know that those are some concerns that I have, because we only had sat for 37 days in the 43rd Parliament first session. So some concerns that I had. Passing on to Dr. Lagasse, an innovation around the new session of Parliament was the Prime Minister's address on a national television on the evening of the throne speech. Dr. Lagasse, you're a connoisseur of Westminster traditions. What was your take on the Prime Minister's televised address?
Well, to be quite frank, I wasn't much of a fan, but not so much for the content, I should stress. I was simply, to my mind, it was something that was very similar to the speech from the throne, and I would have preferred a different type of procedure and path, namely emulating what we see in the Quebec National Assembly, whereby you would have the Governor General open the session, but have the Prime Minister read the government's agenda, which would then forestall or avoid the need to repeat both. But more fundamentally, ma'am, it's the question of this is a presidentialization of the office, which I believe is to be avoided. And that is the purpose of the speech from the throne as it exists, and having the Prime Minister speak directly to the nation as opposed to in the proceedings of Parliament is not something I would encourage.
Thank you very much. And Dr. Terp, I just want to go on this one. The House is scheduled to begin its regular autumn sitting on September 21st. Is there anything that would have prevented Parliament from being prorogued on September 20th or even on the morning of September 21st to redo this? Was there any reason that we needed to prorogate for 6 weeks and not have committees sitting or doing work in Parliament?
I guess no, and my answer is no, and I've made my reasons clear in my déclaration d'ouverture.
The truth is, to the member, there is no framework for this. So the Governor General has never really wanted to exercise their discretionary power. The government can prorogue whenever it wants to because it's an absolute power belonging to the Prime Minister.
Mr. Terp, do you believe it was an abuse of prerogative or abuse of power?
Yes.
Effective use of your time, Ms. Vecchio, for sure. Thank you so much. Next, we've got, welcome to Mr. Peter Fragacatos. Gosh, Peter, I'm going to pronounce your name wrong. Fragacatos. Thank you for being here, and you've got 5 minutes.
You are the first person in Canadian history to pronounce my name wrong, Ms. Sahota, Madam Chair. So history's been made here at the committee. It's great to join colleagues and hear an interesting discussion on prorogation. I'm sitting in today for our colleague, Mark Gerritsen. I did want to begin, if I could, with Professor Messamore. Professor, you said that, and I wrote down the quote from the testimony, a strong case could be made that the pandemic made the decision to prorogue entirely justifiable. I wonder if you could expand on that.
Yeah, I just wanted to make a clear statement on it. I think that my point really, I suppose, is that prorogation is not in and of itself a problematic procedure. It's a regular procedure. I think the speech from the throne is meant to set out an agenda for the government, and when that agenda is overtaken by other events, I think it's necessary to begin a new session with a new speech from the throne. That was essentially my point.
And so the onset of a pandemic would be a shock to the system, so to speak, to the economic system, to the political system that hadn't dealt with something like this in over 100 years. You're saying, just so I'm crystal clear, that because of that monumental event, the decision to press the reset button, so to speak, was not something that would be completely unwarranted. Is that a fair interpretation?
Yes, it is.
Okay, thank you very much. There was a question, Madam Chair, about, I believe it was our colleague from the bloc who was talking about the number of the period of the most recent prorogation and had concerns about that. I did happen to come across a CBC report that makes clear that the average prorogation period since 1867 in Canada is 151 days. I would note for the committee that the most recent prorogation lasted from August 18th to September 23rd. So I just put that to colleagues' attention. Again, I'm only an associate member of the committee, but I think that point is an important one to consider because without context, without, let's say, historical reflection, if I can put it that way, I think we're missing an important aspect of the debate and discussion here. Again, the average prorogation period since 1867 is 151 days. And I leave that to the committee to consider. Another point that was raised by Professor Lagacé, I think, is quite critical here. So I'm just checking the time on my watch.
2 minutes.
2 minutes. Thank you, Madam Chair. Another point that was critically raised by Mr. Lagacé, and here I wrote it too, Professor, you said that it depends on the eye of the beholder. In other words,
one's position on prorogation is a matter of perspective on the most recent prorogation, whether it was warranted or unwarranted. It really is a matter not of objectivity per se, but one of pure perspective. Mr. Terp, with that in mind, and it would be very easy for me to put to the committee that you served as a Bloc MP from 1997 to 2000. I'll leave that aside. I respect you and see you as what you are, a constitutional legal scholar. So I won't ask you about your previous work as a Bloc MP and as a member of the Parti Québécois shortly thereafter. But I wanted to ask you, are you aware of the work that was taken up by the Committee on Finance and the Committee on Ethics post-prorogation? In other words, when Parliament reconvened in the latter part of September?
No, I must admit I'm not aware, but I am aware that some work has been done, and that committees could and have, to some extent, looked into the We Charity issue. But let me just, let me just read something to all of you, including yourself. I'll read it in English because it's in English. It's that decision of the House of the Supreme Court
Professor,
of the UK.
I have
think
less than a minute.
It's so important that you listen to all of you to this. Paragraph 55. Let us remind ourselves, as the judges are speaking, of the foundations of our Constitution. We live in a representative democracy. The House of Commons exists because the people have elected its members. The government is not directly elected by the people.
Professor, I'm sorry to interrupt,
the position in
but
some
I need
other
to
democracies.
also make. I
hope
clear,
you can all read that case.
Professor,
I make the case that you read all that case.
Those two committees studied the we issue. I know from experience from finance that was the issue we looked at.
Both of you, thank you very much, but we're over time. Madame Normandin, 2.5 minutes.
Thank you very much. I still have questions for Professor Terp. And I'm referring to the ruling in 2019 in the UK. Was this a declaratory or binding ruling in your view? Was it a tool to be used as a guide in the future? Is it something that we could use here? Is it something that the Governor General could use? That is to say, get an opinion from the courts. So I'd like you to speak about that, about the binding nature or not of a court ruling. Well, that's a very interesting question. This was a ruling. It wasn't a referral. It wasn't an opinion. It was a ruling. And it was started by action taken on the part of a citizen. This is what triggered the case. So it's a binding ruling. And the Minister of Justice immediately in the UK acknowledged the validity of that ruling. And steps were taken to reverse prorogation, to abolish the prorogation that was taking place. Now, given that you're allowing me to refer to this ruling, I'm going to read the rest of it in paragraph 55. So after the reference to democracy, look at what it says.
Because it has the confidence of the House of Commons. It has no democratic legitimacy other than that. This means that it is accountable to the House of Commons and indeed in the House of Lords au Royaume-Uni for its actions, remembering always that the actual task of governing is for the executive and not for Parliament or the courts. The first question, therefore, is whether the Prime Minister's action had the effect of frustrating or preventing the constitutional role of Parliament in holding the government into account.
So it's very difficult to think then that Parliament wasn't frustrated in its work in August. Thank you. I still have several questions, but if the Constitution were going to be amended, would I be mistaken in thinking that it's Section 44 that would have to be used? If we didn't want to have to get into many rounds of negotiation? Well, it's not clear.
The answer is difficult. C'est possible que ce soit rigide.
Possibly. It would possibly fall under Section 44, but there are other opinions on that. Thank you.
Thank you, Mr. Blakey. Go ahead, 2.5 minutes.
Thank you. I'd just like to come back to my previous question and ask Professor Lagacé to weigh in on what kinds of options might be available to Parliament to assert a greater influence for itself on the question of when and how Parliament either prorogues or dissolves.
Well, sir, I would simply point out that a number of reforms have been proposed. Some of them trying to create a wedge between the Prime Minister and the Governor General. That may be one avenue that we could pursue. Constitutionally, I suspect that would fall apart before the courts. But more fundamentally, I would also make the point that if we look at the United Kingdom recently, efforts to remove the dissolution prerogative and to give it to the House of Commons were one effort, but that is now being repealed given the unintended consequences that it had. Similarly, we need to bear in mind, even we've lauded the UK Supreme Court quite a bit here today, but this has led to a pushback on the part of the government in the United Kingdom to reduce its powers precisely in this area. So we need to be mindful of the types of reforms that we pursue. But fundamentally, sir, I would say that this is a question of norms. This is a question of how we use power. And that can only be changed by a change in how political actors operate and think about what is legitimate and what is not. You cannot change it through constitutional conventions necessarily. You cannot necessarily change it through codification because there will always be gaps. There will always be measures and efforts to use powers and in ways that may be disagreeable. There is no clear solution here other than changing the norms, the political norms of what is acceptable around the use of power. And that is fundamentally what I point to, because as we've seen in the United Kingdom, efforts to simply remove these powers or to transfer them to the House of Commons comes with their own problems.
And I do hear that. I think sometimes those efforts to box in those powers are part and parcel of driving changes in the norms, however. So if you don't have concrete proposals about how you might change things or prerogatives the government might lose if they don't use them respectfully, then it's hard to change the culture and to change those norms. I wonder if Professor PROC might like to weigh in on this question with the balance of my time.
You're on mute, Professor PROC, and you have just a few seconds, really.
Okay. The role of Parliament is very important. One evolution that we've seen coming out of 2008 is for Parliament to provide information to the Governor General. You could make a requirement that if there's a prorogation, that also information goes from Parliament to the Office of the Governor General.
Thank you, Professor PROC. Mr. Tucker, 5 minutes, please.
Thank you very much to our witnesses today. We have what we're discussing here, let's get to the root of it, is the WE scandal, where $500 million of taxpayers' money went to a kids' charity that paid off the Prime Minister's Prime Minister's mother, as we know, $500,000. And that's the root of why we're here today, or the cause. And this is a Prime Minister that has been corrupt or ethically challenged, where he's the only Prime Minister that has ever been visited the Ethics Commissioner this many times. There's no other Prime Minister that has been found guilty of this. So that's the root of why we're here today. Today, to the witnesses, we have the Deputy House Leader, Deputy Whip, some of the leading Liberal leadership with us today. And on these ethically challenged decisions that were made to PROC, it was done on the day that we were supposed to get evidence that was redacted, and now they've learned that it has been destroyed. So some additional ethical issues that arise from that. I come from Western Canada, and there has never been a time that we're more disillusioned with our country, our leadership, and the direction of this country. In the last 9 months, we went into billions and now over $1 trillion in debt that is going to affect future generations that will have less opportunity because of the decisions of this government. And I just want to get your sense, like in the room, we've been all paying attention, but Canadians haven't, because we got a pandemic that we're dealing with, and they're not realizing how much peril we are as a country. And I guess my question to Mr. Lagacé is, do you think the current media landscape and the current population of Canada are paying attention to these issues?
So it's interesting you asked that. In my last class yesterday on Canadian Government 101, that's exactly what we discussed. That the fact of the matter is, for most people, their concern and their focus is on their immediate situation economically, politically. I think it's fair to say that the proceedings in Parliament, as interesting as they may be to those of us that are in this room, are not front and center in terms of what people are focused on. And I think that's a fair assessment. But so quite simply, I would say that no, I believe, and we see the public polling here, that Canadians are supportive of their governments and focused on the executive and its actions at this point in time. As much as it may be regrettable to somebody like myself who is focused on Parliament, I don't believe that that is front and center in their thinking at this moment.
So is that the pandemic, or do you think it's the changing landscapes in media, that people aren't consuming news like they used to, where this is going to get swept under the rug, or this is the desire of the leadership of the Liberals that are in the committee today, is that we're going to forget about this?
Well, I think you can certainly run out the clock, and the reality is, but I would simply point out, sir, that there's an interesting facet here, which is, if you'll recall in the last Parliament, efforts to shut down the Justice Committee around another controversy were seen by the government as a means of getting out of the problem. Ultimately, I would submit to you that it maybe didn't work out that well. And those of us who are in academia saying, you may want to simply let these committees go. If there is no problem here, show it, get it over with. Don't try and obfuscate, and because it can have a blowback effect. And ultimately, I would submit to you that it did. We resulted in a government being reduced to a minority of seats or a plurality of seats in the House of Commons. So these efforts can ultimately come back to haunt governments if they're not careful, including around committees. So they may actually gather more attention than we realize.
So what would you say that they would risk their government over then? This has got to be pretty terrible if they go to this lengths. Would you agree?
Well, I would say fundamentally, this is what's of interest. Political parties have an interest, and I would say this, that I suspect it should be in the government's interest to actually simply allow the committees to do their work, because whatever is there, transparency, sunlight is often the best disinfectant. And as we saw in the last Parliament, it turned out that there may not have been the controversy there that some were alluding, and therefore it is often best to simply go ahead and allow these committees to do their work. I believe short-term political considerations oftentimes are take the forefront when long-term considerations should perhaps be taken into greater consideration. But sir, I just don't know enough about, I can't speculate about what may or may not be within the documents. I'll stick to my institutional knowledge.
Well, it seems like the documents have been destroyed, so we're not as Canadians going to find out how bad it was that they would risk their government over this, and risk Canadian lives as well in the middle of a pandemic. Disrespectful for all the people that have been working so hard to counteract the effects of this pandemic. To PROC during this time period is very challenging. Our system, and probably the witnesses are all, I would hope, with the Westminster style democracy, it relies on a functioning media so that the public can be informed, good or bad, of the tools that we provide to the government to conduct themselves in a functioning.
Thank you, Mr. Tucker. Thank you.
You're welcome.
Next, we've got Mr. Turnbull. 5 minutes, please.
Thanks, Madam Chair. And I appreciate this discussion very much, and I think it's an important one. I totally disagree with some of the assertions of the member that came before me. I wonder, I think this is a conversation about how do you prove the motive or intent behind prorogation? And I think I would ask, Ms. PROC, to your knowledge, is the Standing Order 32.7, who introduced that standing order?
The Liberal government did.
Right, so it requires that reasons are provided, and that's exactly why we have a tabled document that extensively outlines the reasons that the Prime Minister used this prerogative that he had. Is that your understanding?
Yes, and it's very important. Committee work as well as that standing order is important, I believe.
And who ultimately decides whether those reasons are justified or not?
Ultimately, the public.
Thank you for that. I would also ask, is, Mr. Lagacé, in your remarks, you talked about prorogation being used to clear the slate, start afresh, and often, citing significant events. Would you consider a global pandemic a significant event?
Certainly, if one were trying to identify the clearest reason for prorogation, a significant event such as pandemic could be, and probably in this case, would be offered as the most legitimate reason, yes.
And could that shift the agenda of the executive branch of government significantly?
Yes, absolutely.
Would that seem reasonable? Okay,
Yes,
great. Thank you. And when you talk about tactical or hardball prorogation,
there's a problem with your mic, Mr. Turnbull. We'll just pause for a minute. It's actually quite bad.
Mr. Turnbull, it's Justin here in the committee room. You might want to unplug your mic and plug it back in, and that sometimes addresses the issue. Mr. Turnbull, can you speak a bit, and we'll check if you're better? Okay, now you're completely quiet. Madam Chair, we'll have to suspend while we try. Oh,
I'm actually having trouble hearing you now.
Takes a minute usually when you've unplugged and plugged back in. So go ahead, Mr. Turnbull, again.
Okay, can you hear me now?
We can, but there's a lot of static. I don't want to, we've had a lot of injuries with the interpreters. So I'd like to make sure that we can get that resolved rather than having them work through that. It's okay. Quite staticky.
Madam Chair, if you just suspend for a minute or so and we'll try to address the problem from the room.
Okay.
Well, I close a few more windows, and my apologies for the technical difficulties. I think I had a lot of windows open. Does that sound any better? I just closed a whole bunch.
Yes, it does sound better.
Okay, great. I was midstream there, so my apologies. But I was beginning to ask about tactical or hardball prorogations, which is a term that Mr. Lagacé used. And I wondered if you could comment on whether the prorogation of 2008 on behalf of Prime Minister Stephen Harper would be, in your view, a tactical or hardball prorogation. It's been, in many cases, said to have avoided a confidence vote. Would you agree with that?
I would say it was hardball, but as you'll see at the end of my remarks, I also point out that there may be a justification where the government feels that the Commons or parties in the Commons are engaged in an equal degree of hardball, and so you can say was that effort to oust the government immediately after a confidence vote an equal measure. And you'll excuse me, it happened to happen during my testimony, the bill. But yes, so I will say that in that case, I would qualify it as such.
Great, yeah, thanks. And were you aware that Stephen Harper's government also prorogued for 32 days in 2007?
Yes, sir. Or 2009, you mean, sir?
No, 2007 for 32 days, 2008.
Okay. Yes, no, prorogations are as a routine procedure. You mean in a non-controversial setting, correct?
Yeah, Yeah,
Yes.
and 2008 for 53 days, and 2009 for 63 days, and 2013 for 33 days. Were you aware of those over 6 years, those 4 prorogations?
Yes, I'm aware of prorogation. I would point out, though, sir, I think an interesting facet, a number of people have raised the number of days in Canadian prorogations. We should also look to the United Kingdom, where they are oftentimes about a week long. So we should do a comparative Westminster perspective as well.
Thanks. And on that point, were you aware, Mr. Lagacé, that prorogation only delayed the restart of Parliament by 2 days?
Yes, sir, I was. But I would point out as well, though, that the number of sitting days that Parliament lost overall was a cause for concerns. Just the general propensity in the pandemic of the inability of Parliament to sit as often as it might want to was an issue.
Let me ask you this, Mr. Lagacé. Were you aware of this committee in PROC doing the hard work of trying to figure out how to operate virtually and have the House of Commons actually sit throughout a pandemic? And did you know that we had to fight hard for changes to the standing orders with opposition parties to actually cooperate to allow us to operate virtually?
Yes, I was following it quite closely. My concern, though, is
Thank you for that. Yeah, thank you for that. And what about voting virtually? Were you aware that voting is such a key aspect of our parliamentary proceedings? Were you aware that we had to fight tooth and nail and debate at length to get opposition parties to agree to allow us to vote by video? I'm sorry?
We weren't able to get your answer, but it would have to be a short one. We can hear you.
Madam Chair,
because they were seeking in-person
Yes.
sessions, I believe.
Correct. Yeah, which would have put people's health and safety at risk. The
Time is
All
up.
the time we have.
Thank you, Madam Chair.
Thank you, Ms. Vecchio. I'd stated it. I guess Mr. Turnbull hadn't realized. Okay, so next we'll carry on with Mr. Lukiski, please, for 5 minutes.
Thank you very much, and thank you all to our witnesses for being here. I just want to go back to a question that Professor Turp had answered earlier, and I'd like to get the same opinion and the same question will be posed to all of our witnesses. And that is when Ms. Vecchio asked Mr. Turp, given this particular circumstance of prorogation, not in the normal sense, but in this particular situation where the government prorogued, and in Mr. Turp or Professor Turp's opinion, they did so for political or tactical reasons, he considered it to be an abuse of power. I would ask Professor Lagacé, Ms. Brock, and Ms. Massimore the same question. Given the particular circumstances of this government proroguing, which effectively shut down committee work for over a month, and the necessity of prorogation has been questioned by all of our witnesses, would you consider this to be an abuse of power? Professor Lagacé, I'll go with you first.
I would say it was regrettable, but not necessarily abusive.
Ms. Brock. Unfortunately, Ms. Brock, you're on mute.
Sorry. Problematic, but not abusive.
Thank you. And Madam Messamore.
I would again say no, not an abuse of power. I think that the Crown is there to protect in a true case of abuse of power as a kind of a constitutional fire extinguisher. And I don't think, given the circumstances, it hit that criteria despite what we've all agreed are regrettable circumstances.
Thank you. I'd like to go back then to the discussion we had about the necessity of this prorogation. And despite the fact that the government has submitted a report, which I find lacking, quite frankly, in detail and rationale, I would like to ask again the four of you whether you think that this particular prorogation, given all that has happened since, was absolutely necessary, in your opinion. I will start with Professor Turp.
La logique de quelqu'un qui prétend que...
Well, when you say that something is abusive, that means it wasn't necessary. And I think it was not necessary as well as abusive. I respect my colleagues' opinions, but I would be curious to know what public opinion would be this time round. That is to say, whether or not prorogation should have been used. As well as in previous times, there were other governments, including the Conservative government, that I feel also abused that prerogative, including in 2008 and 2009.
Thank you. Professor Lagacé.
No, I don't believe it was absolutely necessary, and nor in terms of the procedure itself, nor in terms of the length.
Thank you, Ms. Brock.
No, it was not absolutely necessary, but ultimately that is the call of the Prime Minister.
It most certainly is. Let me just make a comment on that. That's why I asked the question previously about whether or not, in your opinion, you consider this to be an abuse of power. Certainly it is within the Prime Minister's prerogative to prorogue whenever he feels he should or would, for either political reasons or other reasons of, say, an emergency nature. But given that the Prime Minister did exercise his prerogative to prorogue on the eve of several committees receiving information that could have further implicated the government into the WE scandal, I find, to say the least, that the timing of prorogation was curious. Madame Messamore, did you think that the prorogation in this specific instance was necessary?
Well, again, if it is to be understood, as I think it should be, as a routine procedure to set out a government agenda, then I would say necessary in that sense, in the light of changed events. Just one minor point. I don't think that the term Prime Minister's prerogative is accurate here. It is the prerogative of the Crown exercised on the advice of the Prime Minister. A minor, but I think important point.
You're quite right. My apologies for that. You're quite right. Madam Chair, how much time left?
You have 45 seconds.
In that case, I'll cede my time. I know we're running over time right now, and we have question period coming up, so I'll conclude my questions.
Thank you. I wanted you to be able to get your round in because we did have a little bit of a technical difficulty there. So that brings us to a conclusion to today's testimony. So I would like to thank all of the witnesses. All four of you have brought great insight to our beginning of our study. And we thank you for that. So thank you for taking your time out. We know you're all very busy. With that, I will adjourn for today, and we will see you all back after the winter break when the session resumes.
Happy holidays.